Doctor, I have here your initiative, or no, let me go right to the core of what's happening right now. Flu shots are very important. I know you and your staff are very involved here in getting the word out. Can you talk to us about flu shots? Because I know many people that, for one reason or another, do not seem to want to get them because they've heard it's a different strain or it is double the dose. They're afraid. They don't realize, I believe, and you correct me if I'm wrong, that it's a dead virus.
Yes, absolutely.
It's
a killed virus. And again, one of the most important things that we can do in terms of remaining healthy is to prevent infections. And flu shot is the best way to prevent infections from the flu. As you know, flu is dangerous. It does kill people, especially the elderly and the patients who are immunosuppressed. So it's very important to identify yourself, speak to your physician, and actually go and get the flu shot. We have about 36 to 50,000 deaths a year as a result of flu and complications from the flu. And really, it is preventable. I mean, as a physician, I would recommend every patient who is, and again, the CDC at this point is recommending anyone over the age of 6 months to be getting the flu. There is no shortage of the flu vaccine right now. And the vaccine actually contains 3 strains of the flu virus. One is the H1N1. That we were so well prepared for dealing with last year, and then 2 additional strains. So you have 3 strains in the flu vaccine right now. And really, especially patients over the age of 65, if you are immunosuppressed, you have chronic conditions, everyone should be getting the flu shot.
I think it's important, but I was amazed at the figures you just gave out to our listeners and to me on how many deaths from the flu that are, from what you're saying, which I believe 100% is absolutely needless.
Yeah, absolutely needless. And again, and we're not even talking about the hospitalizations. So the hospitalizations as a result of the flu are in the hundreds of thousands. And so, and most of these hospitalizations do occur in the older adult population. And you know, once you're in there for the flu, again, the hospital isn't the best place to be. You can get other super infections or hospital-acquired infections, other complications. And really, at this stage, we all want to be in our homes and be comfortable, especially with the holiday season and all coming. So this is something that you can actually do today.
There is always a joke among what I'll call the senior class, at least the 65 and up, you know, because we're geared to the 45 and up audience, but we have a lot of 65 and up. And the word on the street is, if you're sick, avoid the hospital. and you know, there's a lot to say for that, because there's where you have, unfortunately, diseases, problems with the sick, the infirmed, what have you. But the flu is such an important, the flu shot is there. Every country in the world would like to have the quality of a flu shot that we have and able to give it to the masses. And yet, there's still talk. You read about groups that don't want to. There are people that go on radio and television and talk about, I'm not getting it.
Yeah, and one of the things that we're actually working on is also getting the health care workers immunized against the flu with the flu shot. And, you know, a lot, when you talk to other physicians and nurses and other health care workers, they feel that they're immune because they're always exposed to illness in the hospitals. And that's another big issue that we're working on with our hospitals and healthcare community to help increase that awareness, because really no one is immune. And even if you are not sick, you can still be spreading the virus to other people around you that may be prone to getting not just an infection, but a dangerous infection. So it's part of what we need to do as society to help one another, fight the flu and remain healthy.
I hear so much, and I tend to believe it, and I practice it all the time now. 3 words: washing of hands. Will you comment on that?
It is so critical. I think that's the number one thing that everyone should be doing, especially if you're working in a healthcare setting. And if you, again, have the flu or want to prevent the flu, there is no limit to the number of times you can wash your hands. And you have to do it for at least, as though you're singing the happy birthday song twice. So it's not just going in and quickly rinsing your hands and walking out. It's actually at least 15 to 20 seconds. under warm, lukewarm water where you wash your hands. So there is nothing that comes, above that in terms of preventing infection.
I have to ask the question. Did you coin the phrase "Happy Birthday" twice?
No, actually, it's pretty well,
Is it
accepted.
really?
Yeah.
Because I think I must do it and I do it quite often during the day.
Yeah, that's absolutely great. It's a great practice, and again, if you want to prevent infections and you want to stay healthy, just do it as much as you can.
That would seem to be like the person's first line of defense, literally, washing of the hands.
Yeah. And actually, they recommend that if you are seeing a physician or you are in a hospital and you see your physician or nurse not having washed their hands and come to you, you should actually ask them to do that. I mean, that is your right. No healthcare provider or professional should be examining you without washing their hands and wearing gloves.
A person wouldn't be embarrassed by asking that?
Well, you know what? I consider that as an empowered, informed, person who's helping our profession and our healthcare system.
So the professional should be more than willing to do that if he or she has forgotten or lapse of memory or whatever the case may be.
I mean, you're running around between patients, and that happens often. And it's just a quick reminder, and really no one should take offense.